Um, and there it is. So good afternoon and welcome to CESLC Insider. Every other Wednesday at noon, you can join us to find education on topics that matter to you. I'm your host, Angelique Jackson, Manager of Business Development and Marketing. And here at Charles E. Smith Life Communities, we deliver care and experiences personally tailored to those we serve, no matter where they are in life's journey. Our full suite of services include independent living, assisted living, memory care, post-acute care, and long-term care, as well as primary care with a focus on older adults at Hirsch Health Center. To explore all that our campus has to offer, please visit our website at www.smithlifecommunities.org. Or you can call Greg Smythe or Tony McCarthy at our Welcome Center to schedule your private tour today at 301-228-0641. All this information will be provided to you in the chat, so check there if you need more information. So I want to say thank you to everyone who's tuned in today. We want to hear from you, so please add your questions to the chat. And then also a big thank you to our sponsor, Optum, who sponsors all of our insider events. A few reminders before we begin. Like I said at the beginning of the presentation, we will be recording. And so this video and others will be on our YouTube channel, so you can view those at a later time, and they will be provided to you in the chat as well. And so let's begin. So today Insider welcomes Margie Hackett. Margie is a transition guide nurse manager, with Suburban Hospital, a member of Johns Hopkins Medicine. Margie has worked at Suburban for over 35 years and has a passion for helping patients to understand and manage their chronic health issues at home once they're discharged from the hospital. Today, she joins us to teach us how to thrive while living with diabetes. Good afternoon, Margie, and thank you for joining us.
Thank you for having me.
So I want to get started on the presentation. First, I want to ask you to define for our audience, what is diabetes? How is it diagnosed? What are some common risk factors for developing diabetes? And what are the different types of diabetes?
Wow, well, that's a lot in the beginning, but that's a good place to start. Let's go to the next slide. So I'm gonna actually, before I do that, I want to just give you a quick look at, why do we always talk about diabetes? Diabetes is very prevalent and way more around, and people have it way more than we think and way more than people know. So looking at this slide, we've got 34.2 million have diabetes in the United States. And that's about 1 in every 10 people. And 1 in 5 don't even know they have it. So that's why this is a problem. If you don't know you have it, how can you even address it? So it's a big problem. Let's see what the next slide says, because I think that's where my thing's going. Okay, hang on. We're going to talk about this. Click the slide one more time. We want to show you that the cost for healthcare dollars is really going up related to diabetes. And that's part of the problem, is people don't know they have it, and they really need to understand more about it. When they find out they have it, they need to be able to address it. And the costs are just going higher and higher. Okay, so what is diabetes? Here we go. I knew I had a slide. So what is diabetes? It basically, the way our body handles food is we eat our food, our body puts insulin into our bloodstream. The insulin pushes sugar into the cell, which cells need the sugar to grow and do all the metabolic processes that we need. And then our sugars go down, and then we eat again and sugar goes up, we make insulin, and it gets pushed into the cells. What diabetes is the cells do not take the insulin. So there's a couple different kinds, and we'll go into that in a few minutes, but the cells are not, they're resistant to the insulin pushing the glucose into the cell. And that's really what it comes from. So it keeps the sugar high in the bloodstream. And as a result, you can have a lot of complications. Let me see what the next slide is. Okay, let me just go a couple seconds into the different types of diabetes, and then we can talk about and start some of your other questions there, Angelique.
Yes. Right.
So type 1 is an autoimmune disease. Those patients, those people, excuse me, they're not patients, they're people, residents, they really require insulin to live. We all require insulin to live. What type 1 diabetes does is they're not making the insulin. And so that's a problem where that's why they need to give shots to themselves. They're not making insulin. And that's often diagnosed when you're younger, up into your teenage years. It is possible to be diagnosed for that as you get older, but it is more common to get type 2 diabetes as you get older. Type 2 diabetes is your body makes insulin, but you're not able to use it. And again, it's where you have that resistance of getting the sugar into the cell. And then there's a third kind, gestational. While somebody's pregnant, often they get gestational diabetes. And that is, again, the same kinds of problems. The blood sugar is high during the pregnancy, has the same potential complications of diabetes, same potential complications of high sugar, and often returns back to normal when you have your babies born. Let's go to the next slide. Okay, so trying to figure out your questions. Yeah.
So we already talked about what diabetes is.
Right.
We talked about the different types of diabetes.
Mhm.
Now we need to know what are some risk factors for developing diabetes. And then also maybe, I know we talked about type 1 is an autoimmune disease, but why would our cells resist the insulin that we already produce?
Oh, good. I don't even know if I know the answer to that question. Why would it resist? That's a good question, and maybe I can think of it while we're talking today. Sorry.
I'm just thinking of that.
Yeah, it's a good question. Anyway, so what are the signs and symptoms that you're developing? So when your sugar is high, there are several things that could be happening, and it's different for everybody. So not everybody feels it. But when your sugar is high, it can cause some trouble with your vision, blurred vision or darker vision. It can cause pains in your joints. It can cause some nerve damage in your feet or in your fingers and hands. The biggest way really to know to prevent it is another story I'll tell you in a second, but the biggest way to know that your sugar is running high and you have diabetes is really to be in touch with your primary care physician. That is super important that you see a primary care doctor, also known as an internist or general practitioner or family practitioner, any of those physicians that you have in your team, on your medical team. See them on a regular basis, and they should be checking certain blood tests for you, such as fasting blood sugar or blood glucose is the same thing, or a hemoglobin A1C. We'll go into more details about those numbers. That really is the best way to know when you have it.
Okay.
Is knowing that those numbers are out of whack, and then if they're climbing, they can tell you that you're heading in that direction. What can you do to sort of prevent it? And we'll get into that a little bit as well. On this slide, I wanted to tell you, what insulin resistance and more specifics is. I started to feel hungry and tired. So you're feeling hungry and tired. We all have that, all different parts of the day, several times a week, maybe. It's normal. That doesn't mean you have diabetes, right?
Right.
You're tired and hungry, you get something to eat, right? Gives you some energy, you feel good. Your body makes the insulin, like I mentioned earlier, but your cells resist that insulin. They say, hey, no, I'm not taking any sugar in my cell right now. And so what happens is then that sugar is stored as fat. So instead of going into the bloodstream, it's stored as fat. It comes out through your urine. And as being stored as fat, so people put on weight without really like, I'm not eating anything more, I'm exercising the same, but they're putting on weight. And that fat storage is seen often in the belly fat, in the belly. But again, if you're storing it as fat, then you're still feeling tired and hungry. You're eating more food because you think that's going to make you feel better, but you're not making more insulin. You're not getting the insulin into pushing this glucose into the cell. So obviously it's a vicious cycle there. Let's see what the next slide says. Okay, so I wanted to talk to you about some of these blood tests. I mentioned the fasting blood sugar. Fasting blood sugar, I don't have a slide on that, but generally it should be under 100 when you're fasting. And normal would be like 80 to 100. Now, if you have diabetes, a normal could be up to 120 or even a little bit higher. And part of what we're going to talk about today, Angelique, really is everybody's diabetes presents differently, right? Everybody feels it differently, has different symptoms. The foods that you eat, if you had diabetes, the food that you eat will affect your body one way. And if I eat those same foods as a diabetic, the food will affect me a different way. So you can't really relate that to other people. You have to figure out what your body does and reacts to different food, how it reacts to the medicine, how it reacts to your sugar levels.
Interesting, yeah.
So the fasting blood sugar, like I said, normal is like 80 to 100. The hemoglobin A1C is really a more definitive diagnosis for diabetes or pre-diabetes. and I'll tell you more about that as well. Anyways, hemoglobin A1C, what that means is, let me go back. The fasting blood sugar is what your sugar is right now at this time, okay? So if you were to stick my blood right now, stick my vein right now and give me some blood, if I have 110, that's what my sugar is right now. But I also could be putting out insulin possibly to get it into the cells, and it might go down because I might have a balanced normal if I don't have diabetes, a balanced insulin sugar process. If somebody is not a diabetic, is a diabetic and their sugar's at 110, we don't know if that's climbing up or if that's climbing down. It depends when they ate last. It depends when they last had their medications. So that fasting blood sugar is really just a point in time right now. What the A1C does, it's a measure that accumulates what is your blood sugar average for 3 months. So the A1C can be drawn every 3 months and be a new value at that time.
Okay.
And that's a good guide for the doctors to see. This A1C is, and I showed you a little chart here. If your A1C is, we're going to do an example. A1C is 6. That means your average blood sugar in 3 months at a 6, it would be 126 is the average blood sugar. So you could have some 80s, you could have some 150s, but your average is 126. And you can see that chart on here. So the numbers are on the wording on the left is what I really want you to see. So if people have no diabetes, their A1C level should be between 4 and 5.6. Okay. And if you have pre-diabetes, your number will be between 5.7 and 6.4. And sometimes, you might be at 5.7, and if it stays at 5.7, that's great, right? But if it progresses up, you really are heading towards having diabetes, and you really need to take some action, and we can go into some action about what is that action to prevent it. If you have a 6.5% A1C or higher, you have diabetes. Sometimes your doctor might say, your number's climbing, you don't have diabetes, your number's climbing, just watch your food intake or just cut down on the sugar. And I'm here to tell you, I want them to actually do more. Because I want them to get you to understand that this is something that will definitely become diabetes if you're not watchful. And there's a lot of things that you can do. And I'll talk about it now because I can't remember where they're on the slides. But, basically, if you're in those ranges and you see your range going up, you really want to get on a regular routine of exercise and activity. Exercise doesn't always mean going to the gym. It could be lifting weights in your house. It could be lifting canned foods in your house. It could just be doing some exercises where you're leaning on the counter in the kitchen. It could be taking a walk every day. So there's a lot of things that exercise doesn't mean, the big stuff that everybody seems to do running to the gym, because not everybody does that. And it's a turnoff for some people. You wanted to ask me a question.
Oh, yeah, I just wanted to make sure that between 5.7 and 6.4, which is pre-diabetes, right? There's still hope.
There's still hope.
And you feel that moderating your diet and your exercise can help put you back into between 4 and 5.6.
It's very possible.
Okay.
Some people stay pre-diabetes for a long time and don't ever advance. And I'll give you a little personal story. I now have pre-diabetes. I've been watching my number go from 5.7 up to I'm at 6.1 right now. And I've been exercising. So sometimes stuff happens. And stress, we have some other slides about that. Stress can bring it up. There's a lot of different things. And actually, let me tell you now about this. So you're at risk of developing diabetes if you're overweight, are 45 years or older, if you have a parent or a brother or a sister with type 2 diabetes, if you're physically active less than 3 times a week, if you've ever had diabetes during pregnancy, or if you're of African American, Hispanic, Latino American, Native American, or Alaska Native culture. Those are definitely things that are very at risk of becoming diabetes. You can prevent or reverse pre-diabetes with simple lifestyle changes, losing excess weight, eating healthy, and having regular physical activity. So, there is hope, yes. And I don't want to give people that if they have diabetes, there's no hope. There's always hope. Having diabetes is just something you need to control, kind of like if you have congestive heart failure, or if you have COPD, or if you have they're not an end-of-life diagnosis. It's a way of living. It changes the way you see things. So, of course, we want to prevent diabetes. And I think we go into the complications of diabetes in a little bit. So on this slide, I wanted to just show you, it's kind of hard to see. I'm sorry that it's a little blurry, but this, I remember this from when I first started in nursing long ago, explaining to people, well, how do I know I've got high blood sugar? This would be for whether you have diabetes or not, technically, but the same symptoms happen if your blood sugar is climbing. You feel really hungry, you feel really thirsty, you might feel drowsy, or you might feel alert. That's not as common. Dry skin, some people have very dry skin. And if you put lotion on every day, you won't feel that, right? And nausea, blurred vision, if you have to go to the bathroom a lot as well. Let's go to the next one. Next one.
I just want to say before we leave this, how many times do I have one of these throughout the day?
Right. Well, do you get your blood checked with your doctor?
I do.
Check that out.
do.
Okay. So
I
then
do.
you know. So the really big clicker is what's the A1C? That's
Know
a
your
really big thing.
numbers.
But
Yeah.
you do need to know your numbers. For hypoglycemia, hypo meaning low. So it's the opposite of hyperglycemia. But look at this. Some of this looks the same. Colors on there. Weakness and fatigue is on there. Irritable, and you can be irritable with high as well. Shaking. So some of these are different. Impaired vision if it's high. I want to give you a little anecdotal story here.
Please.
Of a patient who I used to see at home. She was actually somebody I grew up with. She was a friend of my mother, and I used to do case management in the home. And she called me in to start visiting her when she was told she had diabetes. And she goes, Margie, I don't understand. I felt so good. Her sugar was 800. She goes, I felt so good, but I was so happy the doctor had found it. I don't know how long it had been like that, but she started feeling better once we got on the medicine, got her sugar down. But she felt great that high. So you might think it's great and you feel wonderful. I have no idea why she felt wonderful, but she was just surprised that we had to get her sugar down. She's like, but I feel good with it high. I'm like, no, you don't want to have it high.
I'm interested to learn how she felt after it was managed.
She felt fine. She
Oh,
felt
she
good.
felt fine.
Yeah.
Not
We
very
were
country
treating a lot of different things, helping her learn to live with a lot of different things at that time. Yeah. It made me laugh. I was like, I don't know what to say to you about that. Anyways, okay. So self-care behaviors. We've talked about that just a little bit, but this is the American Association of Diabetes Educators. Yes, that's it. I'm sorry, I wrote it down so I would remember. Did I get it right? Yes, I did. And so the American Association of Diabetes Educators has 7 self-care behaviors that they want to recommend for everyone. And this is really good for people who are not diabetic or not pre-diabetic, because really they're healthy, balanced situations for our life. Healthy eating is important. So, the fats, the carbohydrates, the proteins, the vegetables, the fruits, everything. Being active, talked about that. Monitoring, meaning check your blood sugars, know what they are. Have the doctor check the levels that you need by the blood stick. Take your medication as directed. And honestly, some people are taking their medication they think is the right way. Always good to review it. We, the medical teams, healthcare teams, know that we use certain words, certain things that might make perfect sense to somebody else. And we want them to really be clear. So there's no harm in reviewing it again. So if the doctor says to take a medicine twice a day, talk to the doctor. Do you mean breakfast and dinner? Do you mean breakfast and lunch? Do you mean breakfast and mid-afternoon or evening? Because your dinner might be 8 p.m. It might be too late. So go through that stuff with the doctor. If the doctor says, I want you to take insulin twice a day, what are those 2 times? How is it related to your meals? And even if he gave you a message that, when you first got that instruction, review it with him the next time you go to see the doctor, because it might click a little bit differently based on what your numbers are running. And he'll say, oh, I want you to move that 1 hour earlier or 1 hour later or whatever. So just review it each time to make sure that the doctor has the understanding of when you're taking it at what time of the day. And I would do this honestly with all your medicines, but really with your diabetes medicines a lot. Problem solving. If you see something of a question, you're not sure, ask a question. Problem solving doesn't always mean you solving the problem. It could be meaning, I'm not certain about this. I want to ask this question and get it answered. And if you are seeing a trend in what you're doing at home, you're seeing a trend in your sugars, you're seeing a trend in your activity, and you think your sugars should be coming down, or you think your A1C should be coming down, have those questions, those consultations with your doctor, because it could be just, some little thing that you need advice on that is, in those 15-minute calls or visits with your doctor. Sometimes you can't address all of that. Healthy coping. Well, again, That's for everybody, right? Everybody needs that.
Especially if I have to mind my carbs.
That's right. That's right.
Yes.
And of course, reducing the risk, which we mentioned.
Mhm.
You got to stay active. So low activity is an increased risk. If you, what was the other one? How come I can't remember these three? Losing excess weight. So how do you know what your normal weight is? Speak with your doctor about that. I mean, I just told you I'm now pre-diabetic. I admitted that on screen and it's recorded. But you know, I put myself on a diet last year. And what does that mean? I'm still eating 3 times a day with snacks. I'm just paying attention to what's going in my body.
Mhm.
And I realized that I did like my chocolate. I'm still eating a little bit of chocolate.
Don't
But
deprive
not,
yourself.
yeah, because you want to still be happy, right?
Right.
Chocolate makes you happy. So you just have to figure out what is the right thing for you, but you do want to reduce your risk as much as possible so that you can continue to have a good quality future that is happy, healthy. You can still stay independent, and you know, you don't have the complications, which, did I talk about that? I feel like I didn't talk
We
about that
haven't
yet.
gotten to the complications
Okay.
yet, but even on this slide, these self-care behaviors can, you know, pertain to anybody.
Right.
And it really helps you to be more mindful, you know, mindful of what you're putting in your body. And I love how monitoring your values, your numbers. There's this quote, and forgive me because I forgot who said it, but it says that which is measured can be improved.
Yeah.
So, yeah.
Yep, that's why we always want data. Give me the data.
Give me
right?
the data.
So I
Give me
can
the
track the
numbers.
data. Yeah. Okay, so I want to talk about, we will get to the complications for sure, but I want to just talk a little bit about, well, why am I here? Like, how did I get asked to do
Yes.
this program
Why don't you
today?
tell us why you're here today?
So Suburban Hospital is part of a grant with the state of Maryland, and the 4 Maryland Hopkins hospitals and 2 University of Maryland hospitals have gone into this grant with the state of Maryland to help bring more education about diabetes to residents in Maryland. We're not the only hospital system that is doing this. There's several. I really don't remember how many are in the state that are doing this, but they gave out probably at least 10 grants to help us put programs in place and get the education out to everyone. There is another, I know another hospital system in Montgomery County that's also doing these educations. It's Adventist and Holy Cross system are sharing as well. So, so there's a lot going on in Maryland as well as in Montgomery County. I just wanted to let you know, when we talked, I showed you about the increase in healthcare costs for diabetes in 2017. I'm sure they're even higher in 2022. And really, you know, these people don't just have diabetes, so you have to really look at them as a whole, right? How many other situations do they have? If somebody has kidney problems and they have dialysis, they have to eat certain amounts of food. So you have to balance out that food that we guys can't see my fingers, but I'm talking on the table here. But you have to balance out that food intake to watch for their dialysis situation, their kidney situation, but it also needs to be balanced with their diabetes. If somebody has heart failure as well, the big one with heart failure is watching your salt. There's some other things to be done for that too, but so how do you balance all that out? Sometimes that's so confusing. So these kinds of programs just are super helpful to hone in on the diabetes for you, get you to understand your body, and you actually see results. So when we go to the next slide, I want to tell you a little bit more about the next slide.
And I think, wow, it's just so important to highlight that, the numbers, the first slide that you showed, the healthcare costs, and that our community hospitals are really trying to find a way to educate us to, prevent us from experiencing the complications with diabetes. So.
That's right. That's right. So when is the best time for education? And I don't even know what the top of this slide is. Oh, the right time. I did say the right time.
Mm-hmm.
I can't see the tops of my slides, by the way. Anyway, so really wanted to go into this because there's lots of different opportunities to make sure that you are on target. I mentioned to you guys earlier too about, we want the doctor to be talking with you. We want the doctor to be reviewing those timings of those medicines for you. It's okay. I've got them here on paper. It's all right. We want them to review that with you to make sure that there's not something you're taking the timing, maybe needs to be tweaked. Maybe that's exactly what he wants you to do. And you then can be told, I'm taking exactly how he wants me to do it. And take some notes when you're at the office too. Because sometimes we just find out, medicine, healthcare people say things a certain way that are totally clear to us.
Mhm.
But to people who are not in healthcare, I think healthcare has got its own language personally.
Oh,
You know,
absolutely.
so we're trying to be mindful that we're explaining things to people who are not healthcare backgrounds. But anyways, so back to the slide. The best time to assess for any types of education, diabetes education, is at your annual evaluation with your primary care doctor. Whether you have controlled diabetes or uncontrolled diabetes, and let me define that. Controlled means your sugars are where they need to be. They're in good ranges. Your A1C is either stable or heading downward. That would be controlled diabetes. Uncontrolled diabetes is if your hemoglobin A1C is over 9. That's really critical when it gets up to 9. But let me tell you this, everybody at any stage in their diabetes is really worthy of getting some education, because I mentioned earlier, your diabetes is your diabetes. Your prediabetes is your prediabetes, because everybody reacts differently to food. Everybody reacts differently to exercise. Everybody reacts differently to getting sick. Did you know that when you get sick and don't eat the same way you usually eat, that you actually can really totally off balance your blood sugar levels? So there's a lot of ways that have to be understood when things happen in your body. I mean, you're in particular stress or something. So at an annual review with your doctor, whether your diabetes is controlled or uncontrolled, is a great time to start for education. When you have new complicating factors, so here's some of the side effects or the issues that might be coming if somebody has diabetes and it's getting uncontrolled. You can have wounds that don't heal. You can have new physical limitations. If you're all of a sudden not able to walk as strongly as you used to be, or you're having more falls, or you can't get up off the couch like you used to, that could be a sign that your sugar is getting more out of whack. If you have any diabetes distress, meaning your sugars are just really out of control. If you've been had a change in health status that requires nutritional or medication or physical activity changes, for example, chronic kidney disease has a lot of changes like that. These particular situations would be some of the complications related to diabetes that really is a good time for education. But as well as that is, those are good things to talk over with your doctor. Not if you have something that's not healing the way you expect it to, you need to get your doctor on the phone and maybe go in and see them and have them look at it. It might not even be related to diabetes, to tell you the truth, could be something else. So really don't just assume things are okay. Oh, and I'm going to go back to something else. Just telling somebody this at work, you know, I could say, oh, I hardly ever get colds. And then you get a little older, you start getting colds. And then you start getting allergies. And it's like, it's normal, but maybe it's not normal. Right. Always talk that stuff over with your doctor, because some of the stuff as we get older seems to be normal or acceptable, or you get used to it, you adapt. But it really doesn't mean that you need to adapt. Really, there's sometimes some things that can be done. So don't just accept your changes as you get older. Investigate, ask questions. Okay, another time, a third big time of, I'm going out of order, it looks like, a third big time of a good time to get education is at the time of diagnosis. So if you have a blood sugar, this paper I have here, it's always a little bit different. But if you have a blood sugar of over 126 on 2 different occasions of fasting blood sugar, that is a diagnosis of diabetes. If you have a random glucose of over 200, meaning if your blood was checked, it wasn't fasting, and you had your blood checked at 3 o'clock in the afternoon and you had 2 meals already, whatever. If that sugar was over 200, that's also a diagnosis of diabetes in terms of what Medicare believes, by the way. It's a Medicare ruling here. Okay. And then a fourth time to get education for diabetes is at a transition time. And transition time is a hospitalization or an emergency room visit. A change in your diabetes care team. If you always see the same nurse practitioner or doctor at the office or endocrinologist, and you had to switch to a new practitioner because they retired or went out of the area or whatever, that's a great time to start getting new education. Is there anything new out there? If you started on insulin, that's new. And I want to make sure I say something about that. Remind me to talk about that. Sure. If you have a new diabetes technology, like started a pump of some sort or a different type of insulin, long acting versus short acting, that's a great time for, it's a transition time to start education. And if you're a new Medicare beneficiary, as you can see, this is a Medicare paper I'm reading. But I understand that if you're getting up, into the time frame when you are accepting Medicare and you're primary care, primary insurance is Medicare, that's a good time to do it as well, because some of the rules, some of the expectations for diabetes numbers change as you get older. Somebody younger, they might want you to be, down 120 or less, 120 or less. But as you get to a certain age, they might say 150 or less. And so it's not exactly at 65 when you get Medicare that those numbers change. It all depends on who you are and your activity. But those timings are really important to get education at the right time. And so you can see education is important in all parts of your illness with diabetes. And even pre-diabetes, right? We just talked about that.
Right, and I thought something that was interesting was that the fact that certain medications that you're taking, that are totally unrelated, could increase your blood sugar.
Yep.
And how important it is to stay in communication with your primary care physician.
Right, and I'll give you one example, steroids. People take steroids for different kinds of infections or lung problems. Here and there, it shouldn't be long-term, but yes, taking that will definitely change your blood sugar, and so you don't get scared, right?
Right.
And you might have to adjust your insulin during that time with the steroids if you take insulin or medications. And I wanted to talk about the insulin real quick. So a lot of times people will tell me, my diabetes controlled, I'm taking this pill and I'm exercising, I'm doing all this stuff, but all of a sudden I have to take insulin and I feel like I've failed. I feel like I'm not doing well. And I really tried, and now I have to take insulin, like it's a failure to keep their diabetes controlled because they need insulin. I want to say right now on the record that is not a failure. You can do everything just perfect and still have some trouble with balancing your blood sugars. And insulin is a requirement. If you don't make your own insulin, you need to take insulin. And what diabetics do when they're taking the pills is those pills help push the insulin that you make into the pills help the insulin you make push that sugar into the cell. But as some people's diabetes progresses, not everyone, but as it progresses, some people stop making insulin. And that's why that you have to go on insulin. It's not a failure on your part. It's just a progression of the illness in certain people. So I don't want you to feel that that's a failure at all. It's just a way you want it. Just what's the next treatment? I want to keep my sugar as even as possible, and I want to continue to have a healthy life. All right. Okay, so back to our program. I just wanted to tell you about, I wonder if I put these out of order, but anyways. So I told you that Suburban Hospital is a part of this grant, and the program is asking us to put in and start programs that are for diabetics, and the program is called Diabetes Self-Management Training, or DSMT for short. So diabetes self-management training is a very individualized way to do education. There's an hour assessment as the first visit, and it's really what kind of food do you eat, talk me through your schedule, what are you on for medicines, let's talk about the rest of your health, how are you balancing all of that. And it's a very comprehensive assessment. It's about an hour. And towards the end of the hour, you're gonna probably help to think, well, what can I work on before I come back? And the instructor will help you come up with some goals for you. What might work for you, and it might be, if you learn in your assessment that you just really like your ice cream every night and it's so important to you and you really like it, and so it might be trying something like maybe going to ice cream 3 nights a week instead of 7, or cutting the amount in half, so you can still enjoy it, but maybe you don't have as big an amount, and start measuring or something. So, it could be something that minor, or it could be, I'm going to start taking my blood sugar every morning. I'm going to start pricking my finger, right? So some people kind of resist having to check their sugar. But again, knowing your numbers, tracking your numbers, right? Tracking the data helps you make some decisions too. So it could be something that minor. So you do walk away after the first meeting with the educator with some sort of short goal, just to get you into it and sort of reliving it. And then the next visit, you get really more into depth. Okay, now I know about you. Let's see how things are going. What have you been doing? Have you been making any changes in your life since the last time I saw you? So it's really very individualized. It can be in person or virtual at Suburban. Either one is what we're offering now, and it could be an individual or group. We don't have any groups going right now due to the craziness of the last 2 years, but we are going to be probably doing some group systems. So when we will be assigning people to groups based on what their needs are, if they have the same kind of issues, right? So step one is they have to have a referral. You guys, to attend the courses, have to have a referral from your primary care doctor. At Suburban, we're getting the hospitalists in the hospital. So the attending physician in the hospital is giving us that referral. If you're in the community, you can also get started with these classes. And that would be getting referral from your physician. And I'll be sending out, I have to give you that flyer that has the fax number for the clinician to send in a referral to us with some information. Step two is getting your first visit, which I just talked to you about, is about an hour. And there says it in step three. Okay, and then step three, so you can get up to 10 hours of education for this program, this education, and it could be done over the course of a year. It could be less than a year, it could be more than a year. You might only want 3 visits and we already see some progress. So there's a lot of variation in what this timing is and what the commitment is. But the real success factor is how you feel and how your sugars and how your blood, your eating is and your weight. It's the real success is you. We started at Suburban, December 13 was our first educational day with someone, and I don't remember if it was the first patient, but somebody from December was telling us by the end of January, they'd already lost 11 pounds.
Wonderful.
And their A1C had come down. So, I mean, just having that, people are coming in, they're coming in, what I hear, they're coming in sort of like, oh, I talked to somebody about my diabetes,
Right.
but they walk out like there's this hope. The team members are telling me they walk out with this smile, like, I think I can do something now. So it's super helpful.
It's sounds like it's very empowering. Now, number one, once you get a lot of education of what's going on, they realize that it can be managed, and they can still enjoy some of the things that they love with a little bit of compromise, right? And the education, it is complimentary, correct?
Okay, it's not complimentary, sorry.
Oh, it's not.
But it's covered by insurance. It's not funny, but it's covered by insurance, which I forgot to tell you. So this is a state of Maryland initiative, right? I mentioned that earlier. And it's in accordance with Medicare as well, Medicare and Medicaid. So Medicare and Medicaid, I'm glad you brought that up because I wanted to tell you guys that it's really hard to get dietitians covered for education and nutrition. Anyway, it's terrible. Some of the doctors' offices have their own dietitian so they can offer education, and that's probably complimentary in that office.
Okay.
Because it's really hard to get dietitian services covered for people outside the hospital. Okay. And what this program does is it does allow, there's certain Medicare codes we can use for billing. And what's happening is Medicare is covering it. There's usually co-pays and what's the other word? Deductibles at the beginning of the year, the deductibles might apply. And in Medicare, it seems more straightforward. The private insurances, the commercial insurances, Blue Cross, United Healthcare, Aetna, they're covering it as well, but it varies based on your plan. So I would expect a copay and the deductible application, but I don't know. Everybody's going to have a different, as we've been seeing, everybody has a different ability of how it's going to be paid.
At least there'll be some assistance to cover some of the costs.
Correct. And wonderful. This is brand new, like brand new in this last year that the state is doing this with Medicare. And usually when Medicare makes some changes, the commercial insurances follow along. So thank you for bringing that up. So the next slide, I wanted to tell you a little bit about how we're doing it in Suburban. I mentioned earlier that we need a physician referral and that the referral needs to come from the primary care provider when somebody's not in the hospital. When they're in the hospital, we're attempting to have all the patients in the hospital who have diabetes, whether they're controlled or not, whether they're on a pump or not, whether they're on pills or just diet and exercise. You have diabetes, some people are totally controlled on diet and exercise. Regardless of any of that, if you have a diagnosis of diabetes, we're having one of our team members go up and meet with you. Maggie or Darlene are currently our community health workers, and they do these visits with the patients to say, your doctor has recommended that you attend one of these consultations. We can schedule you now if you like for in a few weeks, or we can get you scheduled after you leave the hospital. So they're having those conversations. They're handing them a flyer. They're explaining a little bit about the program, and then I want to let you know that we're also doing telehealth now. Telehealth has some brand new. It just has blown up in a positive way since we've had this pandemic, that we can do so many things with telehealth. We're hoping that continues. The public health emergency is being reevaluated now, and hopefully that continues because there's a lot of people we've been able to get in to do education just because telehealth is very possible. And we hope that that continues.
It provides a lot of flexibility,
Yep.
especially what, some folks maybe don't have a ride, don't have access,
Mhm.
or maybe not even feeling well enough to, make their appointments.
Right, right. So we're wrapping it up. We're not going to play this for you. I'm sorry. This is Lenny Berry on the right, Mary Flynn on the left. I wanted to play it for you. It's a 2-minute video about, they are diabetes educators at Suburban. Mary is actually since retired, but this video was made in December, and it's a really nice video, but the audio is really low. And so whenever I've tried to play it on these Zoom things, it's so hard to hear. So we're not going to play it, but that is an active link. You can go right in on that. And we're going to be sending out these slides after.
Yeah, I will make sure to send out the slides and some other helpful resource material as well after the event.
I think the next thing is kind of fun.
So the next thing is kind of fun because we know that there's a holiday coming up,
Yeah.
and diabetes is all about, managing your nutrition and making sure that you make time to get a little bit of movement. And a lot of folks do enjoy that this is a holiday coming up. They enjoy a lot of their favorite holiday traditional recipes. And I'm sure folks who are living with diabetes would like to know how they can still enjoy these wonderful dishes while maintaining a healthy blood sugar.
Right.
And so we have a few recipes that we wanted to share for you from our very own Rochelle Frenew here in our department. And we have melt in your mouth brisket. And I'd be happy also, and Rochelle has already given me permission to share this with everyone once we're finished.
Oh, this is her personal recipe?
Yeah, these are her.
Yeah,
this
I
is
was
what she's
looking
gonna
at
be
them too. They're
enjoying.
exciting. So that's great. So let me go into some really basic education about food and diabetes. You need to still eat proteins, vegetables, pasta, rice, potatoes. You can still have that birthday cake that your grandchild has. You do have to think how big a piece. It should be much smaller, right? You still need to eat all of those foods because your body still needs the carbohydrates, still needs the proteins, still needs the fats. What we try to talk about in diabetes is you need to balance it out. So it's very important to continue to have the carbohydrates. And I put them in a category of the white category because it's pasta, rice, potatoes, popcorn. Did I have a fifth one? Bread.
Bread. How could you forget bread?
So those are all things that you still can eat as a diabetic, but you have to put them in moderation. You have to have them in small amounts. And this is stuff that you will get in this education. I try to tell people to have like a fist, the size of a fist, not the full fist, but like the shape of here. So you can have that amount of pasta. If you're going to a restaurant and you get your, what would the word be? A chicken parmesan, and it always has a side of spaghetti. So the chicken parmigiana, first it has breading on it. So you probably only want to eat part of that chicken parmigiana or strip some of the breading off, right? And then the pasta would be, you only eat this much, take the rest home. Okay, so it's the idea of portion control, that you may still eat that bread, the bread they stick on the table at the restaurant, right? Then you can have one piece and make sure it's a smallish piece, right? But you can still eat it. So, if it's something you love, you can eat, which is why we're talking about melt your mouth brisket.
So brisket then,
Yeah.
so that would be a nice protein. So
nice
still
protein.
the same
Yep.
fist, this side of the brisket?
Yes, still the same fist side of the brisket, maybe a little bit more because it's a protein. It doesn't have quite the same restrictions as the carbohydrates, which are all those white things I just told you about. What's the next recipe? Here we go,
Potatoes.
Potato. Yes, you can have some potato kugel. I guess it depends on how it is made. Is it in a patty or is it in a dish like this? Looks like a casserole dish.
It looks like that.
But again, that would be like the size of your fist. And everybody's fist is a little bit different size. So I would be if somebody has a big fist, I'd try to go somebody has my fist size.
Right.
So maybe like, there's also another way to learn is a plate rule about your food.
Okay.
So if you have your plates a circle and you cut it in fours, 2/4 should be vegetables. 1/4 should be protein and 1/4 should be the carbohydrates. So you put that potato kugel amount in 1/4 of your plate. Lots of different tricks to learn.
I like that. Okay. And now we can't go without Our
dessert.
desserts.
Yeah,
Coconut macaroons.
coconut macaroons. Well, this sounds kind of sugary, but you know what? It's Passover. You deserve a treat. Make sure it's a good small amount, and then make sure whatever, if you have like juice or fruit that day, that maybe you cut down on your juice or fruit that day so that you can enjoy the macaroons at Passover meal. But it's still something that you are allowed to eat. And you know what? You need to treat yourself sometimes. That doesn't mean having a coconut macaroon every day for the next week. But it means, you know what? It's going to be a little higher on Passover day, you know, and that I'm going to be okay. I'm going to be back to my normal tomorrow, and I deserve this treat. So really talk to your physician and how they feel if you're feeling it. If I'm telling you something, your doctor has always told you to stop eating it. I don't want to give you permission to do what he told you to not do. But talk it over with somebody. And that's the beauty of this class, is you can talk it over with these people who are doing the education.
And hopefully he'll, if I want an extra coconut macaroon, maybe I could take an extra walk to
There you
offset.
go. I love that. That's a great idea. Very much. But really, it comes out in balance. We always are talking about moderation, right? Moderation of exercise, moderation of the kinds of food that you eat, moderation in watching TV or screen time, all that stuff is all in moderation. And I'm really kind of worried that we are not answering any of these questions.
We're going to answer them now. So here we are. This is my favorite part of the event. And so let's see here.
Sorry, I've talked a lot.
No, it's okay. Let's see here. Get to the questions. So our first question, what does it mean to be a borderline diabetic?
Thank you for saying that. It's a very good question. And often the doctors use that word and it makes you think that you don't have diabetes, you're just borderline. It actually means you have prediabetes. That's what that means.
So that's prediabetes.
And this borderline wording is really a pre-diabetic diagnosis, and you're heading to diabetes if you don't start to try to do things. I think some doctors also might use it when you have an A1C. What was the number of the A1C?
Let me see if I can remember. 5 to 6.7.
Right. Yeah, 5.7 to 6.4 is prediabetes. So if you say you have like a 5.0 A1C, and then you're starting to climb and you're getting to 5.3, 5.6. So that could be borderline there where you're not there yet, but more than likely, I think they often use borderline diabetes phrase as prediabetes.
Okay, thank you. Our next question, would Hopkins Medicine be able to let someone know of a grant program in other states?
I do not know about that. I can certainly investigate. I can let Angelique know. What I would tell you is this is a state of Maryland initiative with Medicare. I don't know if these things are being done in the other states, but I can tell you this. If you live in Virginia and you are doing a virtual, or you come to Maryland for this education, it still counts in this program, and we can get you in this program. So,
thank you. Good question.
Yeah.
Our next question, should diabetics worry about salt intake?
I do not believe that affects sugar at all. It's a good question, but in my mind, what salt does to your body, well, we need salt, right? We need potassiums and salt to help balance our fluid in our bodies in all kinds of metabolic processes in our heart, in our kidneys, all kinds of stuff. What salt does in your body when you have too much salt is it has you retaining fluid. Now, sometimes people see it in their ankles. Sometimes you can't see it. It's just like a greater blood volume in your blood vessels. But that retaining of the fluid can cause high blood pressure. It can cause other problems in your body. So it does not affect the blood sugar that I'm aware of. It does cause some fluid overload issues. So,
no.
And not everybody's sensitive to salt. Sorry, I don't want to say not everybody's sensitive to salt.
Not everybody's sensitive to salt.
Yeah.
Great question. Thank you. And our next question, which is a really good question, are sugar substitutes good for a diabetic? And then I have to tack on a question to tack onto that. And does it raise your blood sugar?
So what I have been told, and I've not done any research on this recently, you guys are stumping me, is sugar substitutes are fine for diabetics. They do not raise your blood sugar. If you guys know differently, please let me know. But I do not believe that they do. They equal the Splenda, what's the pink one? Saccharin. They have other issues, right? Some of them, they say they're carcinogenic or whatever. But they do not raise your blood sugar that I'm aware of, and they're okay to use. But part of the thing is too to try to like try to really cut down on what your sugar intake is. And maybe you get yourself so much off that sugar that you don't even need as much sugar, which what I've been doing this last year is I'm cutting down on my sugar intake, and I realized I don't like things as sweet as I used to.
Right.
You know, so that has helped me not use the saccharin as much, or I don't know which one I was using. One of those colored packets. But I realized I don't even need it as much as I used to.
Oh, so your palate does adjust.
It does adjust. Yep.
That's helpful to know. And then a follow-up, which substitutes do you recommend?
Well, I personally like the Splenda the best. I don't remember why I picked it. And I think saccharin is sort of going off on the wayside, but I think it's whatever you're comfortable with. If you want to do some research on which one might have some side effects or whatever, but I personally like Splenda the best.
And then maybe, what about monk fruit?
Yeah, I don't know. Is monk fruit a low? We didn't talk about fruit. Let me talk about fruit.
Yeah,
Yeah,
let's talk about fruit.
So fruit is really good for you. And I mentioned how you need vegetables. I mentioned how you should still need to eat those carbohydrates. What fruit is it breaks down into sugar in your body. So technically it's a sugar, right? But it's not a sugar. It's a totally different category from cakes, cookies, candies, ice cream, Pop-Tarts. I don't know. It's sweet stuff. Okay.
Now I'm hungry.
I was going to go to Five Fingers. Anyway, so but fruit is necessary, or we need it. It has a lot of good vitamin C, and we don't want you to not eat fruit. So in talking fruit in general, my recommendation is to have fruit on a regular basis. But again, fistful. So if you have a bowl of monk fruit sweetener, I don't know about monk fruit sweetener. Huh.
Yeah.
I think it's worth trying. I think I need to try it. What was I going to say? So, okay. So when you have that bowl of grapes, for me, I take the grapes out of the grocery store, I wash them off, I put them in the bowl, and then I eat them out of the bowl, right? So what I have to do is I have to take some out of the bowl, put them in front of me, and only eat that, so that I'm not just, so you don't pay attention. Because you know, it's like if you have an open bag of potato chips or popcorn. If you don't take it out of the bowl bag, put it in an amount so you know what you ate, then you could just be eating way too much. So the same thing with fruit. Put a certain amount of fruit, cut up some strawberries, cut up a banana, maybe you have a whole banana, maybe you have a half. If it's a really large banana, I'm only going to eat the half, right? And so fruit is necessary, but try to do it the same amount every day. Like always have it for breakfast, always have it for lunch, or maybe always have it for a snack in the afternoon and breakfast. But whatever your balance is, you want to stick to that as much as you can. Does that make sense? And I'm going to check on the monk fruit sweetener. I do not know.
Yeah, hopefully we'll have an answer by the time we send out the email for this event.
Right.
Well, I don't see any more questions, but thank you so much for all your questions. They were wonderful. Margie?
We want to go to the slide. Can we go to the slide?
Oh, is that the
more.
next?
You have just a couple more.
Oh,
yeah.
Excuse me.
So click again because I have it coming in.
There it is.
Okay, so diabetes education, honestly, is a way to prevent the hospitalization, which will decrease healthcare costs. But really, you really want to be educated on your diabetes and how to manage it. Our program at Suburban starts with conversations in the hospital and with your primary care doctor if you're not in the hospital. If you receive a referral, please schedule an appointment. You should be hearing about, we get a referral on you, you should be hearing from us about getting an appointment scheduled. And know your numbers, really know your numbers, especially know your A1C. I do have one more, not that we have to talk about it too much. Go to the next one real quick. Sorry.
And here we are.
So these are two assessment tests you can take online. These are links that one is for, do you have diabetes? And one's on pre-diabetes. So those are really good, like quick little 60-second question and answer will tell you what your possibility is, right?
Yeah, you're this
even if you don't have your numbers. And then I wanted to also show you that this is our Hopkins Medicine webpage related to our grants, related to our education, and there's a lot of patient information on that site as well for you.
Wonderful. Well, thank you so much. It was very enlightening. I hope everybody got a little bit more understanding about diabetes and how to manage it successfully and still, you know, enjoy the foods that you love while compromising a little bit, correct? So I want to thank everyone. Thank you, Margie, for your time and your expertise. I want to thank again Optum for sponsoring these events, and then also a special thanks to Rochelle for providing us with these wonderful recipes. And thank you to you for joining us today. And I hope you have a wonderful afternoon. And I just want to mention the upcoming Insider event will be April 27th and we will talk about stroke awareness, learn the facts. So I hope everybody has a wonderful and amazing day. Thank you.
Thanks for having me. Everybody have a great day.